Hello, dear students. We'll talk about the traditional and non-traditional method of rehabilitation. So, rehabilitation is an active process whose goal is to achieve full recovery of damage due to disease or injury functions of it. It is unreal to optimal implementation of the physical, mental, and social potential of the disabled. The most adequate integration of its society. Thus, medical rehabilitation includes measures to prevent disability during the period of the disease and help the individual to achieve maximum physical, mental, social, vocational, and economic usefulness, which he will be able within the existing of disease. Among other medical disciplines, rehabilitation has a special place as regards not only the state of organs or body system, but also features a man in his daily life after discharge from the facility. So, um, patients which suffer from different disorders, such as, for example, brain disorders, spinal cord injury, traumatic disorders, cardiac disorders, pulmonary needs to the medical rehabilitation. And it's useful to to protect, and to help to achieve all situation in physical, mental, vocation, social, and all if patient has such problems. So, so they should be usefulness, and sometimes it's important to improve the quality of life of such patients. And medical rehabilitation has such aspects as medical aspect. Medical aspect involves questions of medical, therapeutic, and diagnostic, and therapeutic and preventive plan. Next, physical aspect. Physical aspect important because it's cover all issues related to the application of physical factors. For example, it will be physical therapy, exercise therapy, mechanotherapy, and occupational therapy with an increase in physical performance. All these methods we discussed previously at our lectures. And psychological aspects, the acceleration of the process of psychological adaptation to change as a result of the disease situation in life, and prevention and treatment of developing pathological mental changes. Next aspect is professional, working population, prevention of possible reduction or disability. So if this is a young person or middle-aged person, they should work if it's possible. And for disabled people, to the extent possible, rehabilitation. This includes questions of definition of disability, employment, occupational health, physiology, and psychology, and retraining, labor retraining courses. And very important is the social aspect, and this aspect covers the influence of social factors on the development and course of illness. For example, this is the social security of the patients, the unemployment pension, and relationship of patient and family, and society and production. And The last one is the economic aspect. Uh, this is the last but not the least. The study of the economic cost and the expected economic effect according to different type of restorative treatment and forms and methods of rehabilitation for the planning of health and social economic activities. Next, treatment by physical exercise. Physical exercise or kinesiotherapy. This is one of the most important and effective methods of medical rehabilitation. And this method is really widely used in diseases of the nervous system of various etiology with diverse clinical symptoms. In neurological and neurosurgical practice is determined. On the other hand, the breadth of the impact of therapeutic exercise is various functional system of the body, for example, cardiovascular, respiratory, musculoskeletal, nervous, endocrine, and on the other hand, training and restorative effect of this exercise is a deficiency or failure of various body function. Targeting techniques of physical therapy determined in the specific functional deficit in motor, sensitive, and autonomic nervous system, so trophic area, in the cardiovascular and respiratory activities. And differentiation techniques of physical rehabilitation depending on the type of functional deficit as well as its degree. And adequacy of load exercise therapy, individually dynamic capabilities of patients as assessed by the general state of the cardiovascular and respiratory system, and backup capabilities of the functional deficit of the system at this particular stage of the disease in the occupational therapy in order to achieve the training effect for optimum load. And next one, it will be timelessness, the application techniques of the gymnastics at the early stages of the disease in order to maximize the use of safe functions to restore the damaged, as well as the most effective and rapid development of devices for which the complete restoration of functional deficits. And activation of therapeutic uh, effects of physical fitness through the expansion of methodological arsenal and the volume of exercise therapy, in training loads and coaching effects on certain functions for the whole body of the patient. And combination function finally, and this is important, the combination various means of physical therapy, physiotherapy, massage, postural exercise depend of period of the disease and functional deficits, degree of its severity, prognosis of recovery and functions, and associated complication, as well as the phase of rehabilitation of the patient. Complexity of procedures in medical rehabilitation, exercise therapy with other methods, for example, drug therapy, physiobalneous therapy, acupuncture, hyperbaric oxygenation, apparat treatment, or orthopedic interventions. Next, I want to show you a small video about the rehabilitation process, how it's look like, um, rehabilitation during the different problems, patients' problems, which suffering with, for example, after, for example, traumatic brain injury or after stroke. And now I want to show you robotic arms. So this is like their uh, and one I want to show you post-stroke exercises of upper limb. And now I want to share with my screen with this type of rehabilitation program and how physical therapist will work with such patients, how he will help them to restore their function and to improve their disabilities and to increase the muscle strength and in case of the different rehabilitation. So now I will show you post-stroke exercises for upper limb, and this is you can see the watch this movie and see how it look like the post-stroke rehabilitation. Now I will share with my screen and you will see this movie, and this is a post-stroke rehabilitation, and you can watch this movie how it's look. So you can see here, this is the patient with a stroke, and you can see this is movements with his damaged extremity, and and physiotherapist makes some movements, and he tries to force his stiff joints. And next, we will he make in one position and then another, and a weight from the patient's body he make these movements during the whole in 20 minutes. This is for elbow joints. And then he make the another movements and the shoulders as far as he can. And but he tried to make this is not very, he makes this all carefully. And then he can make movements for his wrist and with one hand, because during the stroke, the patients very often suffer with hemiplegia. Once the one side of the patient will be paralyzed and decrease of the muscle strength, and on the same time will be increase of the muscle tone like the collapsed knife. And very important to make this movement and to work with with her joints, wrist and elbow joints and his fingers, because it prevent contractures uh, um, of this patient. And this is you can see this is movements which he is doing with her hand, and then uh, he make wrist another finger this movement. So he tried to make movements with all his with all her fingers and all the joints of her damaged extremity, and try to make in different position. First of all, patients should be encouraged to increase muscle activity of the weaker limb to participate. This is very important. And and next one you can read here too, and perform the movement slowly. This is important. Ensure that the joints are well supported. Do not move the limb just by holding on its end. Always monitor the pain discomfort and never force the joint to move beyond what it can. Instead, take the joint gently to its limit. And this is a very important and interesting movie. And now we will continue our discussion and our lecture. And now we will talk about, continue our presentation. So next we will talk about their massage. The next type of rehabilitation, physical rehabilitation, this is massage. And really, this is one of the oldest methods of physical influence on the patient's body, because has a lot of different therapeutic effects. And we will a little discuss about these effects. which we use during our medical rehabilitation of the patients, and really they are very helpful, and the results are very good. So, first of all, it will be the tonic effect by increasing blood and lymph circulation, as well as non-specific stimulation of exteroceptive and proprioceptive sensitivity. And there are the classical massage, for example, segmental massage, acupressure pressure, next type of massage. Originally tonic effect on muscles with paralysis. So we use this massage and try to work with damaged muscles of the patients, and is achieved by using different ways of classic massage and in large volume with sufficient force, as well as special type of massage. And next, which type of using this relaxing effect on spastic, locally constricted muscles, carried out using common relaxation techniques of classical massage. You can see through shaking, small vibration, and so on. Perform at a slow pace with the mandatory pauses between meals, as well as using a point and segmental massage of certain points in the zone. And very important, because some of the muscles will be spastic. It will increase of the muscle tone, and in these cases we should to use this type of massage. This is relaxing massage, and in constricted muscles, so they will be these muscles will relaxed, and it will be very good result for this patient. And the next effect of the massage will be the analgesic effect, is achieved by reflex influence of a point, acupressure, segmental, oriental, and classical in a relaxed form massage. Massage is combination of techniques of mechanical action to the friction, pressure, vibration carried out directly on the surface of the human body by hands or special apparatus through the water, air, or another environment. And massage can divide into the general massage and local massage. And depending on the task, distinguish the following type of massage: can be hygienic massage, medical massage, sports massage, and self massage. Hygienic massage. Let's talk about this type of massage. Hygienic massage. This is active means of preventing disease, maintaining health. Therapeutic massage is an effective treatment of injuries and illnesses. There are following its variants. For example, classical applies without regard to the reflex action and is held close to the damaged area of the body or directly on it. Reflexological massage is conducted to the reflex effects on the functional state of internal organs and system tissues, and the use of special methods of acting on certain areas, dermatomes. Connective tissue is in this type of massage effect mainly on the connective tissue, subcutaneous tissue, and the basic techniques of connective tissue massage is carried out taking into account the direction of the lines bending off. And periosteal massage, in this form of massage, by exposure to a certain point, causes reflex changes in the periosteum. And one of them, one type of massage is sport massage. And according to there are following objectives of these varieties. for example, gain, training, recovery, and others. And in medical rehabilitation, it not used separately, only in with medical gymnastics. And now I want to show you the video how about the massage, and you will understand medical massage, how it's will be in clinic look like. And this is medical massage. We very often use this technique of massage with in course with another type of massage, and this is helps release trigger points and therapeutic types of massage. So I will show you this technique over. This is my facial release, and now I will show you this massage, this type of massage. I will share now with my screen to show you this type of massage. So this is my facial release or technique of massage, so you can see. And now wait a little, I will share with the sound. You will hear how better to make this massage. Neuromuscular technique. So this is the muscular uh, this is type of massage which is very effective in case of different diseases. So
and do some nice stretching right here, and move their neck. You with your right arm, you're gonna pull. You're gonna go to right at the base of the occiput and support the coracoid process here, and just pull gently. You're starting to use some just static pressure here to stretch the shoulder and the upper trapezius and get some movement going here. This is a very good stretch. You don't want to lose touch with your client here.
my
So,
facial
and then to
release.
do some warming of the tissue here, you can just do some squeezing here, some petrissage here, and really just remember, all you're doing right now is warming up the tissue, creating some myofascial release however you can. Another one that I like to do is I brace their arm, put, my elbow to their elbow and support the triceps, and then grab the shoulder and then move the ball and socket here, the glenohumeral joint, to try to loosen it up. For people that have adhesive capsulitis, this is very good. You can do 2 or 3 rotations laterally and then 2 or 3 rotations medially. And what I'm doing is with my left hand, I'm assisting right by the scapula and just torquing towards the midline here, getting some movement into that glenohumeral joint. You can also do a little bit of traction. When you do traction, the thumb of your client is always up. And if you are going to go to the back here, the thumb comes down. And this is another one too that you can do if they can. If they don't hurt too much, then you can do this stretch here. And you can also manipulate the scapula from here. So you want to just rotate it towards the midline if they can. Sometimes the client doesn't have that much range of motion, so you've got to be real careful. So, and then like I said, you can do some skin rolling. You want to do the skin rolling, and you can also do some palpation, so you can start feeling. You can find some trigger points here. Actually, this feels like it hurts. Is that better for you? Yeah, I find it a big point. Remember that the trigger points feel like it's a tight muscle tissue, tight fibers. So it feels almost like a knuckle. It's taut. It's a taut fibers. So you want to go ahead and so now I've palpated it, but I haven't worked up the muscle too much. So I'm going to wait. I've done my dry work first. Now I can apply a little bit of lotion or whatever you're going to use, and do something that you want to start stimulating this liquid fibers. So you want to do some friction, whatever it is that you need to do to stimulate the muscle tissue. Here you can stimulate the upper trapezius. I recommend not to use my thumb so much because eventually that's really going to hurt you. So I use both of my fingers, on the posterior area and anterior.
So this is this type of massage, which can be used in the case of medical rehabilitation, and very important that this type of rehabilitation we're using both with physical therapy, with um, next type of rehabilitation, like the kinesiotherapy and other type of rehabilitation. So apitherapy, another type of this is non-traditional method of rehabilitation, and I want to explain you this type of rehabilitation. This is in the medical use of honey bee products. This method can include the use of honey, bee bread, propolis, jelly, and bee venom. Most claims of apitherapy have not been provided to the scientific standards of the evidence-based medicine. So this is a wide variety of conditions and diseases have been suggested by believers in the therapy as candidates for it, the most well known being bee venom therapy for autoimmune diseases and multiple sclerosis. And the exact origin of apitherapy are difficult to pinpoint and can be traced back in the general sense to ancient Egypt, Greece, and China. And for long years ago, for example, use of honey and other bee products can be traced back thousands of years, and healing properties are included. For example, bee venom therapy was practiced in ancient Egypt, Greece, and China, three great civilizations known for their highly developed medical system. Hippocrates, the Greek physician known as the father of medicine, recognized the healing virtues of bee venom to treating arthritis and other joint problems. And today, growing scientific evidence suggests that various bee products promote healing by improving circulation, decreasing inflammation, and stimulating a healthy immune response. The most important active component of the venom is melatonin, which has many useful properties, including powerful anti-inflammatory effects, antibacterial reflex, antiviral actions. However, bee venom in a complex mix of a variety of peptides and proteins, some of which have strong neurotoxic immunogenic effects. There is no standardized practice for the administration of bee venom, and uh, some suggest that it is important it's work like occupational therapy and with the effect of venom, and some of their doctors tell that location is not important. So because of this, there are this is very important to where I think it's important the location of this. The number of stings also varies widely from few to hundreds, and they may be administered either by leaf bees or by injections. This treatment can cause pain and even result in death if the subject has an allergy to bee venom, which can produce anaphylactic shock. Because of this, I want to tell you that this is very a useful technique but method of rehabilitation, but should be carefully because if the patient has allergic reaction, it can be very serious for the life of these patients. It is important to know that epitherapy is not only the use of the venom for the healing after cold bee sting therapy, but the use of all products and usually in combination of products. And these products are also sometimes mixed with other ingredients, especially different essential oils, for example, depend of the condition being treated. Next type of therapy, which we are talking about now, it will be the leech therapy. Leech therapy, this is a method, non-traditional method of therapy, and is the use of the leeches in the treatment of medical conditions. Leeches are, this is worms type of worm having two suckers, one on the or one at the each end, and the patients should buy them only in the pharmacy. This is not this is medical leeches only. And first, second, should the surface should be dry of the skin and to attach to its host. And the front and section cap always contains the mouth with three sharp jars have leaf we Y shaped bud. The medicinal leeches live in clean water and swim freely in the water, and this is very important. And after the procedure, the doctor should fall down this. When attach to its host for feeding, the leeches remains in the place for the 30 minutes or to 6 hours or more as it fills with blood. And during the feeding, leeches can suck from 5 to 15 milliliters of blood, which is several times its own body weight. And you can see the benefits of leech therapy. First of all, there are more than 600 species of leeches that have been identified, but only 15 of the species are used medically, so they are given a class of their own, and they are classified in Hiruda mediciners or medicinal leeches. So this is a special type of leeches. And then the components of leech saliva, hirudin, yes, and acts as a potent, a very important anticoagulant. And Helin inhibit blood coagulation, so will be anticoagulant and anti-aggregant effects. Next, it will be another thrombolytic effect of the leechers, very important. For example, patients who suffer from the or who have the stroke ischemic or has or for example such after heart problems and thrombosis, this is very effective and useful method to prevent thromboembolic stroke, for example. And anti-inflammatory effect of the leeches, very important, very important because for example, patients which have radiculopathy and local pain, for example, back pain, and if we will put these leeches in the area of the pain area, because of their anti-inflammatory effect, they increase the inflammation and decrease and anticoagulation factor and will be decreased of the pain. A spreading factor has urinase, then inhibits the activity of coagulation factor 10 by 4 yes. Next, increase inflamed blood, vasodilatator, and reduce pain during beating by a leech. Leech therapy can be used and is still in use for many diseases of the body. They used to treat arthritis, for example, and other inflammatory processes. It is perfect to those with vascular, for example, arterial disorders, venous disorders, and next, this is, for example, heart problems, for example, ischemic disease or hypertension, when increase of the high blood pressure. Next, we can use these muscles when patient has lung problems, bronchitis, and bronchial asthma. Next, medical lectures can also help is with patient is pneumonia. A problem with gastrointestinal tract can also benefit from leech therapy, especially those who suffer from hepatitis, stomach ulcers, pancreatitis, among others. And next, this is very good and useful in a problem with gynecology and urinary system problems, gynecological disorders, and urinary tract problems. In the last one, this is the skin diseases. For example, psoriasis, herpes, eczema. These methods, when we can use this method of rehabilitation too, and complex with another methods of treatment. And for example, when the patient has increase of the increase the pressure inside of the brain and during the headaches, this is very useful technique. Another. Now I will show you a small video with hirudotherapy during the different disorders, and you will understand how it look like and how useful and this is, for example, I will show a video where the doctor used this technique in case of the patient with psoriasis, with skin problems. And now I will show you this type of traditional method of rehabilitation. So you can see the skin of this patient. Yes, and now from the beginning, I will show you. This is the how it's in the pharmacy. The patient can buy these liters, and you can see how it look like in the clean water. Then they put in the damaged area. For example, this is the skin problems, and you can see how it will be how it will be in this time. And then you should leave them here as doctors and wait 30 minutes, from 30 to 1 hour. It should stay in the skin, and then you can look at this video that they become bigger. They suck the blood and in the affected area you can see, and become bigger. You can see they become bigger, more than 10 times, and they fall down, and in the place will be this in the skin you can see the look here, and then will be bleeding, but this is not bleed, this is not blood, this is oh, you can see, and then we should put to stop this, and for some hours we should put this because it can bleed for a long time. And next you can see here in this, for example, in this leg there are 1 2 3 4 liters, and the sucking here you can see they become bigger, and then they will fall down. And they become bigger and then fall down. They, for example, you can see here, at the beginning it was very small, and after treatment, you can see they become very big. And then they finish the procedure in the way you can see in this video. You can see, and it's very good, effective techniques to treat such patients with with different problems. Next, and the next one. Uh, and the next we will talk about their this technique, which very effective to prevent, for example, their thromboembolic stroke, their ischemic disease during yes, hypertension, and others. And you can see on this here, and eyes, for example, in case of glaucoma, and in the brain, for example, the cerebral palsy. And here on the leg, you can see how it look like. And let's discuss a little about anticoagulating effect of lichens. The licher saliva contains enzymes and compounds that act as an anticoagulation agent. And the most prominent of these anticoagulant agents is the hirudin, which we talk previously, and which binds itself to thrombins and thus effectively inhibit coagulation of the blood. This is very important because it prevents thromboembolic end of the patients and thromboembolic of the patients and really effective. And another compound that prevents coagulation is choline. This, on the other hand, works as an anticoagulant by prohibiting the Lebrun factor to bind itself to collagen, and it is also an effective inhibitor of anticoagulant factors. A clot dissolving effect of lichens. So the action of destabilize is to break up any fibrins that have formed, and it is also has a thrombolytic effect, which can also dissolve clots of blood that have formed. And for example, in these pictures, you can see the photo of knee, yes, joints. And for example, this patient has arthritis. And this is in disorders in which we can use this type of therapy. And one of the another facts very important of the lichens, this is the anti-inflammatory effect of lichens. And act as an anti-inflammatory agent by inhibiting trypsin as well as plasmin, and it also inhibits the action of eccrisin. Another anti-inflammatory agent is aglins. Next effect of the leeches, it will be vasodilatating effects of leechers, and these are three compounds in the leecher saliva that act as a vasodilatator, and they are the histamine-like substances, and the acetylcholine and carboxypeptidase are A inhibitor. All these act to widen the vessels and causing inflow of blood to the side. And very important effect of the leech therapy, it's the bacteriostatic and anesthetic effect of leechers. We will talk about this effect. And so, the of litres also contain anesthetic substances, and it increases the pain of the damaged area, and also also bacteria inhibiting substances, which inhibit the growth of bacteria. Because of this, we can use this during the treatment of pneumonia because of their anti-inflammatory and bacteriostatic effect. And for example, in case of the neuritis, when patient has very severe pain, and we can use this lichers, yes. And in whole, we can use this in neurology, in different disorders, in gynecology, yes, and ophthalmology, and cardiology, and they have very good effect. And what is more, the patient feel who suffer from pain and inflammation will feel relief from the anti-inflammatory and anesthetic effect of leech's saliva. And then leech therapy also helps to normalize the blood pressure of hypertensive individual, as well as decrease risk of suffering from stroke and heart attacks. This is very important because a lot of patients after COVID pandemic, and now with war, they have the chronic stress, increase of the high blood pressure, and increase risk of mm, different strokes or problems with heart attacks. And using this type of non-traditional type of medicine, it's prevent these problems, these complications. Next, blood circulation is also improved with leech therapy, and it helps with the healing process of wounds, for example, as well as wounds lesions caused by diabetes. And very important one, we can use this method of rehabilitation in case of inflammatory process, and one has problems with immune system or with different inflammation in the body because of the bacteriostatic effect. In general, I want to tell you that real this leechers is very effective methods which we can use during our rehabilitation process. And what is more, they can be used not only to treat the patient, but also to prevent different complication because of different disorders. And what is more, that what is more, sometimes this is really no different. We can the patient cannot drink a lot of different different type of drugs, for example, to drink or so on. But in case of this, we can use this type of therapy. Uh, for example, in case of the which method of traditional or non-traditional methods of rehabilitation we can use else. For example, physiotherapy management. We can use management includes such methods like the pain management, yes, physiotherapy management. This is so different techniques to decrease the pain. Yes, next, this muscle weakness, functional deficits, for example, different type, yes, sensory deficits, balance deficits, and joint stiffness, and emotional stress. So this is different directions. For example, pain management in case of neuropathic pain affects the quality of life of the patient, and is common in case, for example, in one patient has a nerve damage, and it the multidisciplinary approach is taken with the most in part of the pharmacology. So we can use different drugs. A physiotherapy This can employ other modalities that show in various studies to be benefits and complementary medicine to pain relief. And this includes which technique we can use in case of the pain. First of all, we can use massage, and we talk today about the massage technique, different type of techniques, um, you see you saw some video how it looked like. Next, the next was transcutaneous electrical nerve stimulation. This is another technique we can use in to in management of pain. Low-level laser therapy. Next, this is the relaxation techniques, acupuncture, another non-traditional method of rehabilitation, hydrotherapy, splint, passive strength and correct transfer skill education. Muscle weakness. And for example, patient has muscle atrophy and functional deficit. And very important that healthy neuromuscular junction is critical for control of muscles and the TANS, so transcutaneous electrical nerve stimulations. This is one. Numerous studies show that this is positive effect on maintaining neuromuscular junction and to prevent the muscle atrophy. And for example, in 2018 study found the use of TANS was most beneficial of the delayed to 1 week post-trauma, and by 100 being most beneficial. It muscle care is very important to prevent damage to muscle units and in particular prevent heat or cold trauma, stretching, overstretching by gravity, incorrect lifting, transferring techniques, contractures of muscles, and next, what we can use as this is one muscle stretching exercise can, this is very important to remember, and I want to emphasize this. We should not to damage the healing nervous tissue, and if the patient feels during these different procedures the pain needs numbness or increased pain, it occurs during our exercise. It means that it is too hard for such patients and can have a negative effect of healing. Next, muscle strengthening exercise are employed as appropriate isometric graded weight progression of when close chain, and use of the pro slings may be employed to assist the movements and take the weight of the limb. And static and dynamic splints can help to rest paralyzed muscles in optimize positioning of the to avoid or stretching or contractions. And static and dynamic splints can help to rest paralysis muscles in optimum positioning to avoid overstretching and contractures. And very important that this extremity all should be in correct position. So it's allowing, they also assist in allowing unaffected muscles to operate from correct position. And on this screen, on my screen, you can see different assistive devices which we can use in rehabilitation program of the patient. For example, you can see in this photo devices from our upper extremity, gears for our wrist, and here we can see the for our joints, for our elbow, and this is this type of devices which we can use. And a recent study found that exercise can enhance axonal growth and neurotrophin via neurotrophin-dependent mechanism affecting adult dorsal root ganglion neurons. And aerobic activity should also be encouraged, aiming for 30 minutes or 4 times a week for its known health benefits. And functional deficits and sensory deficits. In the relearning on functional tasks, the brain is utilized to regain visual tactile and audio tactile interaction. And in the upper limbs, the focus is on the fine motor skills learning. In the lower limb, balance and coordination are areas of focus. Here you can see the sensory re-education aids in the recovery of sensibility, in sensory stimulation, using different types, different objects, and you can see different types, different form, different quality of objects which we can use in our rehabilitation process. Proprioception deficits can be improved using exercise balls, for example, beds, jungling balls, upper extremities, yoga, tai chi, and others. And you can look at this video how we can use it. When muscle stretching exercise can commerce, it is important not to damage the healing nervous tissue. This is very important. And if patient feels numbness or pain or something else, you can finish this exercise because this is too hard for this patient, and it will have the negative effect for them. Um, for the patient. Next next type of method of rehabilitation. This is electrostimulation. So electric stimulation plays an important role in the treatment of different neuromuscular dysfunction with variety, range of application and the possibility of combining this method with others. And this is method electrostimulation is one or the most effective method of rehabilitation. So this is next, electroacupuncture. You can see in this my screen, how it look like. And electroacupuncture is a simple method of indirect application of an electrical stimulation to injured nerve. And it's have good results. And during in case of the nerve injury. Next, this is the stove John stiffeners. Next problem, which we can have with the disabled patients, and the soft tissue of the region supplied by the damaged nerve at risk of contractions if left in the shortened position. And for the joints that have become stiff, ultrasound and laser therapy has been found to provide benefits. And so we can use this type of rehabilitation. And you can see the abnormal joint posture due to imbalanced force across joint. And this is joint contractures, myostatic contractures, and tendon can be, and nerve adhesion, and it's all will be stiffness patients has and pain. Another problem during the rehabilitation, this is emotional stress, chronic neuropathic pain, has allowed they affect the quality of life, and all it leads to depression and anxiety of the patient. Next, very important, patient and family education, and we need to teach the patients or caregivers to take over some elements of treatment if they can safely repeat it without your supervision. Always check first. Patients should repeat treatment multiple times per day in order to be effective and be able to continue post-discharge. Next, this is we should minimize the risk of future nerve damage of these patients, and nerve damage, and prevention of contractures, maintain passive movements of these patients, avoid joint contractures and tissue shortening. Uh, in case of the, for example, nerves damaging, or we can use different techniques, and for example, can be the same exercise prescription. For example, this is in case of the damage of the lower extremity and patient has pain and nerve damage of the lower extremity. And we had to use transcranial, transcutaneous nerve stimulation, massage, gentle straightening, and exercise prescription. So physical therapy to improve all this physical therapy helps us to improve nerve regeneration in humans after nerve damage and remain uncertain and it's very helpful to prescribe all this type of exercise. Electrical muscle stimulation, biolaser stimulation. This method can help with nerve nutrition and regeneration. Magnetotherapy can assist in nerve regeneration and muscle atrophy. Next method will be joint or soft tissue mobilization and is to retain flexibility of muscles, nerve, soft tissue, and prevent deformities. Next important method, or this is the balance training, coordination, strength, and flexibility, and loss leads to reduce balance. And next, we should to use different orthoses for food, for to prevent food drop, skin damage, and fall risk. And during our lecture, we discussed a lot of different methods of rehabilitation of patients, traditional methods of rehabilitation, and not traditional methods of rehabilitation. And uh, I hope that this lecture was interesting and useful for you. Thank you very much for your attention and goodbye.